Our next work session is the Fire and Emergency Medical Services Annual Update. Chief Center.
Chief, good afternoon.
Good afternoon.
That is a shiny new fire station you have there.
Absolutely. Right in the heart of Midlothian. 10 years in the making. We're very happy to have that showcase today. So, Mr. Chairman, members of the board, Dr. Casey, thank you for the opportunity to come before you this afternoon for the annual update on the activities and initiatives of the Fire and EMS Department. Let me begin by offering our department's thoughts and prayers to the two police officers who were shot in the line of duty yesterday evening, and expressing our support for all of our brothers and sisters in the Chesterfield County Police Department in their time of need. It goes without saying that the heart and soul of any successful public safety agency are its people. And I'd like to start this afternoon by thanking the over 550 career Fire and EMS Department members and nearly 200 volunteers who regularly report for duty, willing to place themselves in harm's way so that others may live. I would like to especially recognize those who went above and beyond the call of duty over the past year in performing acts of heroism at some of the most severe incidents that a firefighter could experience over his or her entire career. Lieutenant Waylon Hudgens, Firefighter James Newsom, Firefighter Thomas Brownlee, and Captain Dwayne Garrison placed themselves at great risk searching for and removing trapped occupants at a house fire on Flynn Road that sadly claimed the lives of 2 children. For their actions, these professionals received the department's highest honor, the Medal of Valor. They were also recognized for their service at the annual Valor Awards ceremony in Richmond. Firefighter flight paramedics Nick Ronesi and Thomas Abbott and the entire flight crew of MedFlight 1 were also recognized at the Valor Awards ceremony for performing several risky helicopter hoist rescues under icy conditions last winter along the Appalachian Trail. What is truly remarkable about those in public safety is that they are never really off duty at any given time. Whether they are serving their community in another role, are away on vacation, or just happen to be in the right place at the right time, Chesterfield's police officers, sheriff's deputies, and firefighters do not hesitate to act whenever they encounter others who need their help. Firefighter Thomas Varner, an experienced swiftwater rescue technician, was serving as a volunteer firefighter in his home community of Farmville when he rescued a kayaker in significant distress in the rain-swollen Appomattox River. For his actions, he was awarded the department's Medal of Valor, was recognized at the Valor Awards ceremony, and he received one of the top Valor Awards by Firehouse Magazine, an entry that was in competition with hundreds of others from fire departments, both large and small. Firefighter Jared Brooks was serving as a volunteer firefighter in his home community of Goochland County when he rescued an entrapped motorist from a vehicle crash and fire near Interstate 64 and received burns in the process. For his actions, he was recognized at the Valor Awards ceremony and by the Board of Supervisors in both Goochland and Chesterfield counties. Firefighter Greg Briney was returning home from a family vacation to New York when he and other motorists encountered a woman preparing to jump from the Route 301 bridge that crosses the Potomac River between Maryland and Virginia. When the woman was distracted, Firefighter Briney made his move, pulling the woman to safety, and then assisted police officers in placing her into their cruiser. For his actions, he was recognized by the Maryland Transportation Authority Police. Those in the fire service are part of a broader yet tight-knit family. This past year was particularly difficult for our fire service family when one of our brothers and one of our sisters each made the ultimate sacrifice in service to others. In late June 2021, firefighter recruit Tyvon Eldridge collapsed while completing physical training in recruit school and died several days later on July 3rd. Ty was pursuing his dream job, following in the footsteps of his grandfather, an uncle, and a cousin. His life was cut short before he fully realized his dream. On June 25th, 2022, firefighter paramedic Alicia Monahan, a beloved member of our department, passed away unexpectedly while off duty as she was teaching swiftwater rescue training to a team of first responders in western North Carolina. Alicia was an 11-year veteran of the department and was the first and only woman on the department's scuba rescue team, and she was one of 2 women serving on the Virginia Helicopter Aquatics Rescue Team, the other being a National Guard pilot. Alicia will always be remembered for her devotion to duty and unparalleled service to others. However, her legacy will be the inspiration she provided to countless young women considering careers in the fire service or the pursuit of causes bigger than themselves. As the Fire and EMS Department continues to grow and members retire or otherwise move on to a new chapter in their lives, recruitment and retention has become a constant organizational focus. Over the past year, we've worked closely with the county's Communications and Media Department on a new and improved recruitment campaign through social media, television, and radio. Our recruitment team has visited numerous colleges and universities, worked with the military, and attended many job fairs throughout the community. In the most recent recruitment process, a new written test was implemented, the Firefighter Selection Tool, which is developed by IO Solutions. These changes have produced encouraging results where we ended up with 129 candidates to consider for as many as 50 possible hires for the next recruit school that will begin in January. While this number of candidates was slightly lower than the recruitment process with the highest number of applicants over the past 4 years, it was 79% higher than the previous recruitment process. With the support of the Budget and Management Department, a full-time uniform recruiter will be established in January. And this individual will be tasked with building relationships with Chesterfield Public Schools, colleges and universities, and the military, and maintaining a constant focus on recruitment. Our next recruitment process has started for the July 2023 recruit school, and applications will be accepted through December 11th. So if you know of anyone in your district who would be a good fit for our department, please refer them to our website. I'm pleased to report that the many positive effects of the new public safety pay plan continue to keep retirements of veteran department members low. However, the total turnover rate ticked up to 5.7% during FY 2022 and is already at 2.4% through the first quarter of FY 2023. And this is driven mostly by employment separations among less tenured firefighters. The leading reasons for separation over the past year include pursuit of a different occupation, often with a more stable work schedule that will provide improved work-life balance, leaving to join another fire department, or for reasons of poor performance or disciplinary actions. As we look ahead to the next 5 years, the department's retirement liabilities increase with each passing year. Up to 68 members of the department will be eligible for retirement over the next 5 years, including 45 individuals in various leadership positions. It is expected that the average number of retirements annually could double over the next few years, especially in FY 2024 and into FY 2025. FY 2022 was a very busy year for the Fire and EMS Department, with a year-over-year increase in total incidents of 10.8% and an 18.9% increase over the previous 5-year period. It was no surprise that the fastest growing incident type was EMS, with a year-over-year increase of 11.6% and a 28.6% increase over the previous 5-year period. EMS accounted for 81.4% of the department's workload in FY 2022. Considering incident trends during the first quarter of FY 2023, the department is on track to approach 52,000 total incidents by the end of the current fiscal year. Most incidents continue to occur in areas of the county with the highest density and population. A notable change from the previous year's heat map is the increasing call density to the west along Route 360, with continued growth occurring in Magnolia, Green, and Harpers Mill communities. Fire station response districts experienced a 10.9% increase in incidents on average year over year. The top 5 fastest growing response districts in the county last year included Magnolia Green, Ettrick, Midlothian, Bonaire, and Chester. Now, it's important to note that the new Magnolia Green Fire Station was opened mid-year in FY 2021, which heavily skewed the growth trends for this station into FY 2022. The top 5 districts where incidents occurred last year include Beaufort, Chester, Dale, Bensley, and Midlothian. The top 5 busiest fire stations last year include Dale, Courthouse, Dutch Gap, Centralia, and Chester. Last year, the Fire and EMS Department and our volunteer rescue squad partners collectively transported over 24,000 patients to local hospitals. This represents a 6.1% increase year over year and a 16.3% increase over the previous 5 years. Proportionally, 59.6% of patients received basic life support care, whereas 40.4% of patients required more advanced level care. Because EMS accounts for over 80% of our department's workload today, much focus has been placed on various initiatives to improve and right-size patient care. The Fire EMS Department continues to explore applicable new strategies as part of the ET3 program sponsored by the Centers for Medicare and Medicaid Services. Working in partnership with the Cleveland Clinic and completion of a successful pilot program, staff is now conducting training with all frontline providers and outfitting engine and truck companies with the necessary technology to offer low acuity patients the option of telemedicine. This new service will be expected to be available to all new residents, or all residents, after the first of the year. A significant problem facing EMS agencies across the nation is extended wait times for patient transfers in emergency departments, largely due to hospital staffing shortages. We've worked successfully with our regional EMS council and local hospital administrators to eliminate the practice of ambulance diversions, except in specific cases. We've also put in place processes to force a patient transfer for low acuity patients when ambulance wait times exceed 45 minutes. While it's not uncommon for our crews to still encounter patient transfer times more than 1 hour, it has become the exception rather than the norm. As part of the computer-aided dispatch system replacement project, the department recently implemented the ProQA software that aids in triaging and prioritizing medical emergencies. The ProQA software better matches care with the needs of the patient and helps keep limited paramedic resources available for those patients who truly need advanced level care. With the support of ARPA funding, the department recently expanded the successful MIH program from 4 providers to 6 providers. The MIH unit continues to seek innovative approaches for navigating chronically ill patients and other high-end users of 911 services to more appropriate and less costly care. The unit also continues to partner with law enforcement and other county human services departments working on the front lines of the opioid crisis. By the time of my update to the board next year, I will be able to report out on the activities of the 3 peak time ambulances that will be placed in service after the first of the year. Over the past years...
Chief, can I
Yes.
ask one question?
Yes.
On the MIH programs, I'm a big fan and a big believer in proactive helping people in this regard with services that we can, anything that we can do beforehand. And I think this is a great program because of that, and that we're actually solving a lot of issues before they become recurring issues for your department. I know that we talked about that department being a standalone department at one point, but I know that we also, with staffing challenges, that had not yet happened yet. What is the status of that? What do you see in terms of going forward for MIH in terms of it being its own standalone department?
Sure. So we, it's not going to be a standalone department, but what we have been working to try to do is make it a permanent service in our portfolio, if you will. And so what we had done since 2014 is we had individuals that were essentially temporarily reassigned to that unit. So now, with the assistance of Matt Harris, we've been able to apply some ARPA funding for the first year salaries to make those 6 positions permanent in MIH. And then the effort is to carry those salaries forward in future budget years once that ARPA money runs out. I think it's a 1-year period. So we just recently updated those to 6 positions. So we're moving in the right direction. For the future, I see that program only expanding because I think that there are many opportunities for us, particularly if we can get the federal government to change their reimbursement model so that more and different types of pre-hospital services are covered, that we would be able to expand into other areas. And so instead of sending an ambulance out for a very low acuity call, we could send somebody at a different time of day, say, schedule a visit with a paramedic and maybe even in the future a nurse practitioner or a physician's assistant. So there's all kinds of opportunities for us in the future, but it's been a great program. And thank you for your support for that. So over the past several years, we've proudly partnered with Bon Secours St. Francis Medical Center in their efforts to place a freestanding emergency department in Chester. The Chester Emergency Center opened on May 25th and through October 15th of this year treated over 8,600 patients, making the facility the busiest freestanding emergency department in the Bon Secours Richmond market. As expected, the new emergency center has helped reduce commitment times for ambulances that service the Chester area. The Chester Emergency Center has become the 4th highest patient transport destination for the Fire and EMS Department, having transported over 1,200 patients to the facility over the past 4.5 months. So that's been a big hit in the community. On January 10th, the Pulse Point app went live for Chesterfield County, and there are now over 1,200 users following the Fire and EMS Department, with 385 who have enabled CPR alerts in their preferences. To date, there have been around 149 alerts for sudden cardiac arrests occurring in public places, with 8 of those resulting in actual CPR alerts where users were within 1/4 mile of an incident. We still have some more work to do in marketing this feature to the community and really in tracking the results and successes, if you will, of this program. So hope to be able to report back to you in future meetings as to the successes of the program. But the QR code that's on the screen before you is linked to information on how to sign up for the app and register for hands-only CPR classes that are being offered in the community. And we'd be happy to talk about this in any of your community meetings or pass this along to your constituents. We think it's a good program. Significant service level improvements in a growing area of the county were made possible with the opening of the new Midlothian Fire and EMS Station on September 12th. Midlothian District Supervisor Tara Carroll, County Administrator Dr. Joe Casey, and Deputy County Administrator Clay Bowles were all on hand to welcome the crew as they began providing service to the broader Midlothian area. The new station supports the addition of ambulance and ladder truck service to the area, and we are already beginning to see the positive effects of these new resources in our system. The new 24-hour ambulance service provided by the station responded to 363 incidents in the first 2 months of operation and reduced the workload on adjacent ambulances along the Midlothian Turnpike corridor by 23% on average. We had no 24-hour ambulance service in this area of the county, so all of the surrounding units had to pick up that workload. So that's been a big hit in that area. In particular, if you look at the medic unit that's based at the Courthouse Road Fire and EMS Station, they went from the busiest ambulance in the system to the 9th busiest in the first few months that this new ambulance service at Midlothian has been in operation. The ladder truck, Truck 205, has greatly improved arrival times for a ladder truck at incidents in an area of the county where more densely populated neighborhoods with larger and taller buildings are becoming commonplace. At the recent fire at Allen Tire Company, Truck 205 arrived on scene 7 minutes and 10 seconds faster than what would have been possible before the new station was constructed. So big improvement there, and we're very happy for that. These investments by the Board of Supervisors represent significant improvements in critical services for the residents of Midlothian. Last Thursday, I was honored to have the entire board present as we broke ground on the new Matoaca Fire Station on Hickory Road. The new 15,000 square foot facility will allow crews to cover a much broader area faster than what is currently possible from the older, outdated fire station on Pickett Avenue. Once the new station opens in mid to late FY 2024, it will house a minimum on-duty crew of 8 career firefighters assigned to an engine company, truck company, and an ambulance. The new Magnolia Green Fire and EMS Station completed its first full year of service during FY 2022, and the new station is providing much-needed services to several of the fastest-growing neighborhoods in Central Virginia, including Magnolia Green and Harper's Mill. A formal dedication ceremony is finally scheduled for December 1st after several unfortunate cancellations and delays due to COVID. We'll send those invitations out to you soon. December 1st is what we have on the calendar. I'm pleased to also announce that the Fire and EMS Department was awarded a FEMA Assistance to Firefighters grant that will allow the installation of diesel exhaust extraction systems in up to 20 fire stations in the county. These systems will significantly reduce the exposure of firefighters to cancer-causing diesel exhaust particulates and other harmful gases. On this evening's consent agenda, the board will be requested to accept the grant and appropriate the funds for this project that include a local match from previously identified funding in the Fire and EMS budget. I'm also pleased to announce the completion of an important study that will serve as a roadmap to the future for Chesterfield Fire and EMS and a pathway to eventual agency accreditation. The study, completed by Emergency Services Consulting International, involved a community risk assessment, a standards of cover analysis, and a staffing and deployment study. The report includes 57 recommendations, many of which we have discussed in more detail with each of you over the past several days. In the short time we have left this afternoon, I'd like to highlight various key recommendations that will shape our budget requests and discussions over the next 5 years. First, the study recommends that the department work to achieve and maintain a relief factor of 1.32 for minimum staffing coverage and emergency operations. This simply means the department should employ and assign 1.32 FTEs for each minimum staff position on each operational shift to cover recurring absences and ensure uninterrupted service delivery. The department currently hovers at or just below a relief factor of 1.2, necessitating their use of overtime and in many cases mandatory overtime to staff all fire units and ambulances on a 24/7 basis. Second, the study recommends that the department work with the county's human resources and budget and management departments to develop a workforce plan to appropriately staff all support and service functions in the department. Third, the study recommends that the department prepare to cover service gaps from declines in volunteer activity, a trend that is unfortunately commonplace across the country. Fourth, the study recommends that the department repair, renovate, or replace aging facilities to accommodate the appropriate emergency services needs in our growing community. And finally, the study recommends that the county consider building new fire stations to keep up with population growth and increasing service demands, and complete the construction of critical training facilities. The most critical issue facing the Fire and EMS Department over the next several years is the need to address minimum staffing coverage to reduce the reliance on overtime, and in particular, mandatory overtime. The occurrences of mandatory overtime climbed to an all-time high in FY 2022, and trends for FY 2023 are equally troubling, where the department averaged 9 mandatories per day during the first quarter of the fiscal year. This condition is not sustainable as it contributes to fatigue, increases the risk for errors and accidents, and presents long-term health consequences for our firefighters. It also places significant stress on firefighters' families, particularly those in two-income households, and presents additional challenges for recruitment and retention. We are beginning to hear of instances where the continued employment of a spouse is even at risk for repeated unscheduled absences for child care when their firefighter spouse is held over for an additional 24-hour shift and is unable to be home on their regularly scheduled days off. While COVID has played an outsized role in firefighter absences over the past several years, there are much broader staffing pressures affecting our daily staffing levels, resulting in up to a 19 position deficit at times during the first quarter of this fiscal year. To keep this in perspective, this is the equivalent of over 3 fire stations, or up to 5 engine companies and 2 ambulances worth of staff. In addition to a historically low relief factor, it can take 7 months or longer before vacancy replacements are hired, trained, and released to the field to begin staffing fire stations. There are also many different reasons for regularly recurring absences, including temporary duty assignments, injuries and illnesses with long recoveries, maternity leave, military deployments, and both scheduled and unscheduled leave and PTO. Moreover, we now have 4 generations among our workforce, with younger generations who value their time off and may not regularly seek overtime opportunities beyond their typical 56-hour work week. While it is necessary to provide more flexible leave options to remain competitive in the employee marketplace, it comes with a cost for 24/7 operations with minimum staffing requirements. So what are we doing in regards to minimum staffing? Well, we've worked closely with Matt Harris since 2017 on efforts to increase minimum staffing coverage, and he's graciously provided help with whatever the budget will allow along the way. Whenever we hire staff now to stand up a new fire station or response unit, enough personnel are provided to meet a 1.3 relief factor for those stations and units. This included the Harrogate and Magnolia Green fire stations and the new ladder truck and ambulance services at the Midlothian Fire Station. There have also been increases in staff and various support functions which help reduce the number of times frontline firefighters are temporarily assigned to perform other duties, such as serving as a training instructor at the academy. In January, we'll hire 12 new positions for minimum staffing coverage as approved by the board in the FY 2023 budget. In each successive year of the 5-year financial plan, there are 6 new firefighters recommended for minimum staffing. We also have an outstanding grant application with FEMA's Staffing for Adequate Fire and Emergency Response, or SAFER grant program, that if approved will fund 20 new firefighter positions for minimum staffing coverage. You may recall about a month ago, the city of Richmond got a pretty sizable grant for hiring firefighters, and this is the same program that we've applied for. We remain optimistic and hope to hear some positive news in the coming weeks about our chances for this grant. If, however, we are unsuccessful in this grant opportunity, we will be requesting a significant increase in the number of those hired for minimum staffing coverage next year, as we could easily find ourselves in an untenable situation with a high number of retirements expected in FY 2024 and into FY 2025. While the door to volunteerism is always open here in Chesterfield, we must be prepared at all times to step in as the ever-increasing training requirements and service demands make it difficult for volunteers to participate at levels needed for a busy metro-sized community. The recent addition of 24-hour ambulance service has bolstered EMS coverage in Midlothian. However, to the south, the Manchester Volunteer Rescue Squad has struggled for several years now with consistent staffing, and this district is often left unstaffed for over 30 hours per week on average. The projects in the county's upcoming bond referendum will address various recommendations from the ESCI study, including the replacement of the Chester and Ettrick Fire and EMS stations and the renovation of the Clover Hill and Dutch Gap Fire and EMS stations. While the focus over the next 5 budget cycles will be on improving minimum staffing coverage and replacing or renovating outdated fire stations, we should begin discussions in the coming years as to when and where the next new fire stations will need to be built to keep up with population growth and service demand increases. The ESCI report recommended 4 new stations in the future, not in any priority order, as each has compelling reasons for consideration. In the Dale District, there is the future Five Forks Fire Station. This fire station would be of strategic value to the entire system due to its central location in the county with quick access to Route 288. In an area of the county where the Dale, Matoaca, and Bermuda districts converge, there is the future Highland Station. This station will address fire protection needs for the highest concentration of homes in the county in an ISO Class 10 area, where homeowner insurance is often difficult to obtain and premiums tend to be much higher than in other areas of the county. In the Midlothian district is the future Old Hundred Fire Station that will be needed as development continues to the west of the village of Midlothian and along the future Woolridge Road connection. And finally, in the Dale District, there is the future Salem Church Fire Station that will address service demands and improve effective response force coverage in neighborhoods to the east of the county government center. Finally, the ESCI study recommends completion of facilities at the Enon Public Safety Training Center. This includes the replacement of temporary bathroom, shower, and classroom facilities with a permanent fire support building that will better accommodate the large number of new recruits that are expected in the coming years. Mr. Chairman, that completes my presentation this afternoon. I'll be happy to answer any questions the board may have.
Questions for the chief? Questions for the chief? Anybody?
I don't have a question, but I want to thank the chief for his presentation and for the study that we saw just the other day and for your highlighting the needs there. I have to say that, as I've always stated, safety, public safety is one of the highest priorities of this county. And I always will support it as a supervisor, as I always have. As you articulated, the minimum staffing, I think, is critically important that we move in that direction regarding our budget, and certainly support that Highland Station. I think that has a high priority there for those residents. And so I'm in strong support of that, being on the CIP, as well as supporting our firefighters and their well-being. I know that's been an issue too, you know, their health as you pointed out, in terms of exhaust. I think that's so important. So it's my sincere hope that we will receive that grant, as you point, that $4 million grant, and certainly let us know as that develops and keep us posted. But this, again, is a very, very high priority in the budget. And I think citizens see that when incidents occur, such as we saw last night in Chester, but throughout the county, when we have fires, such as at the business in Midlothian recently, we see the need and importance of safety. And it points out that it has to be, as well, our highest priority. And again, the well-being of their families, as you pointed out, spouses who work as well, that's a part of it, the equation. So I thank you, and I strongly support that, and you have my unqualified support moving forward budget-wise.
Mr. Chair.
Yes, sir.
Mr. Carroll.
Excuse me.
I guess I can echo everything that Mr. Holland just said for sure, but I will also say that I want it to not fall on deaf ears to your staff and to your rank and file that, you know, after the presentation the other day, looking at how much money we're paying in overtime in order to be able to meet the staffing requirements, it is obvious to us that we need to increase our staffing, and that we could actually increase staffing to fill these positions and spend less money if we actually filled the positions. And even if we filled them within the next 6 months, we realize it's going to take a long time to get that relief out there. And so I just want the staff to know that we are aware of this, and we, as Mr. Holland said, will support moving forward with trying to get some people hired to try and alleviate this issue, because the one thing they're not making more of is time. And so as your officers, firefighters have to work more overtime, it's less time they get to spend with their families, less time they get to spend doing other things. And I think time management is one of the best things that we can do for our employees to try and help them to enjoy life. So we are aware of it. Thank you.
Thank you, sir, for your support.
Thank you, Mr. Carroll. Chief, I'm still in awe and grateful to each member of your department for all that they did during COVID. And I think that can quickly be said and forgotten. You know, they've said COVID's endemic now, but we should not forget that you all answered the call during every one of those tough days for people and families in Chesterfield County. It will not be forgotten, sir. And we are just extremely grateful to you and your men and women. Thank you.
Thank you. I couldn't be prouder of our men and women that went the extra mile and did whatever needed to be done during that very difficult time.
Absolutely.
Thank you.
Thank you.